everyone, I am Coraza. In today's video, I will discuss on how to address the issue about teenage pregnancy. So, first, we'll define teenage pregnancy. So, teenage pregnancy is when a woman under 20 gets pregnant. It is usually refers to teens between the ages of 15 to 19, but it can include girls as young as 10, and it's called teenage pregnancy, or also known as adolescent pregnancy. So adolescent pregnancy are a global issue, but most often occur in poorer and marginalized communities, and many girls face considerable pressure to marry early and become mothers while they are still children themselves. So teenage pregnancies increases when girls are denied the right to make decisions about their sexual and reproductive health and well-being. So the causes of teenage pregnancies are the following: the lack of information about sexual and reproductive health and rights. The second is inadequate access to services tailored to young people. Then family, community, and social pressure to marry, and sexual violence. And another is child early and forced marriage, which can both a cause and a consequence. And lastly is the lack of education or school dropout. Then the health consequences of teenage pregnancy, or the effect of teenage pregnancy to the baby, are the following: the low birth weight, less than 2.5 kilograms. Then early birth or premature. Pregnant adolescents often give birth earlier than expected, before 37 weeks. Then infant death. Pregnant teens often do not get adequate and prenatal care, which can lead to detrimental consequences for the baby. Then another is the effect of pregnancy to the teenager, which are the high blood pressure, often occur during the first pregnancy or pregnancy-induced hypertension. Then difficult to labor. Pregnancy adolescents often have high risk of obstructive labor due to small pelvic cavity, which may lead to the use of tools to assist delivery or instrumental delivery. Then anemia, and lastly is birth complications that can result in an infant death. Then the long-term effects are pregnancy teens are at higher risk of living poverty, unable to maintain a stable job, ending up in abusive home, having children who have low grades in school, and having daughters with a higher risk of becoming pregnant during teenage years. This fact is derived from studies conducted by the American Academy of Child and Adolescent Psychiatry. Then another is every teenager needs to know the effects and consequences of risk behaviors that will lead to teenage pregnancy. The pregnant teenager may encounter many problems which will affect family relationships and society. Then how to address teenage pregnancy? To address teenage pregnancies, all government agencies and instruments are directed to identify and implement practicable interventions such as comprehensive sexuality education and employment opportunities for young people, and health promotion through media and communications. Then these are suggestions for improving the situation, which includes developing of community-based approach which utilizes school, sex education integrated with parent, church, and community groups. The second is increasing teenage knowledge of contraception. And lastly, the third suggestion is to provide counseling and medical and psychological health, education, and nutrition of the mother and father in order to reduce low birth weight babies and the school dropout rates. So that's it for today's video, and I hope you learned something on how to address teenage pregnancy.